Communication and autistic child communication skills are important for all children. These skills help children express their needs and wants. When children can do this, it helps them with behavior, learning and socializing. Autistic children have a range of communication skills and abilities. Some autistic children have very good communication skills, whereas others find it harder to relate to and communicate with other people. Also, some autistic children have difficulties developing language, find it difficult to understand or use spoken language, or have no language at all. Autistic children often need support to learn and practice skills for communicating with other people. Autistic children sometimes communicate differently from typically developing children. They might use language differently. Use nonverbal communication, communicate through behavior. Use of language. Autistic children might mimic or repeat other people's words or phrases, or words they've heard on TV, YouTube or videos. They repeat these words without meaning or in an unusual tone of voice. This is called echolalia. Made-up words say the same word over and over. Confuse pronouns, referring to themselves as you and the person they're talking to as I. When autistic children use language in these ways, they might be trying to communicate, but it can be hard for other people to understand what children are trying to say. For example, children with echolalia might learn to talk by repeating phrases they associate with situations or emotional states, learning the meanings of these phrases by finding out how they work. Physically manipulate a person or object. For example, a child might take a person's hand and push it towards something they want. Point, show and shift gaze. For example, a child might look at or point to something they want and then shift their gaze to another person, letting that person know they want the object. Use objects. For example, a child might hand an object to another person to communicate. Behavior. Autistic children might behave in difficult ways, and this behavior is often related to communication. For example, self-harming behavior, tantrums and aggression towards others might be a child's way of trying to tell you that they need something, aren't happy, or are really confused or frightened. Making the most of autistic children's attempts to communicate. Here are some ways you can encourage communication with your child. Use short sentences. For example, you can teach your child to nod their head in reply by modeling this for your child. Give your child enough time to understand and respond to questions. Practice communicating with your child on topics or things they're interested in.